Welcome to today's session on biochemistry. Question number 1. A patient presented with dermatitis, diarrhea, and dementia. Which of the following vitamin deficiencies would you suspect in this patient? So, this is a classic case, dermatitis, diarrhea, and dementia. It's a case of vitamin B3 deficiency. Pellagra is characterized by a classic triad of D3 Ds, dermatitis, diarrhea, dementia, and is caused by severe deficiency of niacin, vitamin B3. Next question. A young boy, he presented with hypoglycemia and muscle cramps on exertion or while playing. So then he becomes normal after resting for a while. So these episodes are recurrent after a period of activity. He has decreased serum lactate and glucose levels. So this is the indication here. He has decreased serum lactate and glucose levels. Which of the following diseases is most likely to be suffering from? The options are Hertz disease, Cory's disease, Anderson's disease, and McArdler disease. So this is a case of McArdler's disease. McArdler disease is it's one of the type of glycogen storage disease type 5 is caused by deficiency in muscle glycogen phosphorylase. So it is caused by a deficiency in muscle glycogen phosphorylase leading to exercise induced cramps and a failure of blood lactate to rise during exercise. So this is a classic case. Next question. A family consumes only polished rice. A family consumes only polished rice. Which of the following combinations of vitamin deficiency and enzymatic defect will be present in this family? The options are riboflavin glutathione reductase, riboflavin transketolase, thiamine transaminase, thiamine transketolase. So in this case, if it is polished rice, we will suspect B1 deficiency. So that is thiamine, and there are two options relating to thiamine, and here we will go with transketolase. The answer is transketolase, thiamine transketolase. Milling and polishing rice removes the outer thiamine rich aleuron layer leading to beriberi. Thiamine pyrophosphate is a critical cofactor for pentose phosphate pathway enzyme transketolase. Next question. A chronic alcoholic patient presented to the casualty with confusion, ataxia, and painful eye movements. So triad is here: confusion, ataxia, and painful eye movements. What could be the vitamin deficiency seen in this patient? So this is also one of the classic vitamin B1 deficiency. So classic triad of confusion, ataxia, and ophthalmoplegia. It defines Wernicke's encephalopathy. So this is a secondary to B1 thiamine deficiency common in chronic alcoholism. Next question. A 4-year-old child presents with easy fatigability. The mother also complains that the child has increased hunger between meals, which is relieved after food. So liver examination revealed no glycogen. The enzyme most likely deficient is. So in this case, liver examination revealed no glycogen. The enzyme most likely deficient is. Options are A, glucose 6 phosphate, B, debranching enzyme, C, glycogen synthase, D, glycogen phosphorylase. The answer is glycogen storage type 0. It is caused by deficiency in hepatic glycogen synthase, resulting in a total failure to synthesize glycogen. Hence, it is completely absent on biopsy. So, next question. A child was brought with pedal edema and chiliosis. Cardiomegaly was present. What is the vitamin deficiency associated with this clinical presentation? So in this condition, there is pedal edema, chiliosis, cardiomegaly. So what is the vitamin deficiency associated with this clinical presentation? The options are pyridoxine, riboflavin, thiamine, and niacin. So let us take the hint. Cardiomegaly combined with pedal edema points towards wet beriberi. So since it is beriberi, we will go with thiamine. Wet beriberi is caused by thiamine deficiency and presents with high output cardiac failure, cardiomegaly, and peripheral edema due to systemic vasodilation. Next question. A chronic alcoholic patient is diagnosed with gouty arthritis. What biochemical changes will be seen in this patient? A chronic alcoholic patient is diagnosed with gouty arthritis. What biochemical changes will be seen in this patient? Options are A. Increased urate and lactate levels. B. Increased levels of alkaline phosphatase. C. Decreased NADH or NAD plus ratio. Increased urea and urate levels. The answer is increased urate and lactate levels. Ethanol metabolism increases the NADH NAD plus ratio, favoring the reduction of pyruvate to lactate. Excess lactic acid competes with uric acid for renal excretion, rising serum urate levels. It rises serum urate levels. Next question. Question number 8. A child presents with erythematous scaly patches in the perioral region. Mucosal ulcers and impaired epithelial wound healing. The most likely mineral deficiency associated with this condition is. So whenever there is delayed wound healing or impaired wound healing, we will suspect zinc deficiency. Options are zinc, copper, iron and calcium. 4 deficiency they have given. So whenever there is wound healing is delayed, we will go with zinc deficiency. That is most common. So acrodermatitis entropathica is caused by zinc deficiency and typically presents with a characteristic triad of perioral and acral dermatitis. Alopecia and mucosal ulcerations are there. So next question. A patient presenting with bleeding gums and easy bruisability was diagnosed with scurvy. So this is due. The patient presented with bleeding gums and easy bruisability was diagnosed with scurvy. This is due to option A, low calcium, B, increased keratinization of epithelium, C, defective collagen formation, D, inhibition of clotting factors. So we know it is scurvy, it is vitamin C deficiency. In vitamin C deficiency, what happens? So there is a defective collagen formation. So that is the answer. Scurvy is caused by vitamin C deficiency, which acts as an essential reducing agent, that cofactor for prolyl and lysyl hydroxylase. So this leaving collagen structural fragile due to lack of cross-linking. So for collagen formation, we need vitamin C. So that is the answer here. Next question. Question number 10. Which of the following is seen in a low insulin glucagon ratio? Options are A. Activation of glycogen synthase. B. Activation of phosphofructokinase 1, C. Activation of lipoprotein lipase, D. Activation of hormone sensitive lipase. The answer is activation of hormone sensitive lipase. So a low insulin glucagon ratio, it promotes CAMP, cyclic AMP dependent phosphorylation via protein kinase A, activating hormone sensitive lipase to induce lipolysis during fasting. So this is a case of fasting. That is why that insulin level is low. So insulin level is low. It's a fasting case and has taken place in this case. So these are the 10 questions of biochemistry. We'll meet in the next video. Thank you.
I don't ever slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up. I don't ever slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up.